Hello and welcome to the 1% Solution. Here you'll find tips and tools to help you acquire more physician clients one small step at a time. I'm Dr. Vicki Rackner, your host. Today I'd like to offer you the main point from a talk I gave entitled The Obamacare Primer, What Financial Advisors Need to Know to Help Physicians Build Wealth in the Era of Obamacare. The main point is that physicians' pain is your business opportunity, and let me explain. Obamacare is a public health policy intended to take care of the entire American population. However, doctors take care of individual patients, not populations. Let's think of the problem to which Obamacare is the solution, which is the 44 million uninsured Americans, as a breast cancer. When Obama signed this legislation into law, it was like the surgeon took a scalpel and surgically excised the tumor. This is a systemic problem, though, and will need chemotherapy. We'll need further systemic treatment, and this treatment is going to take the form of how we pay for access for 44 million more Americans. There are simple, common-sense solutions that we could use. We could take a look at our healthcare spending and identify line items that we could decrease. Here are some possible candidates. The most attractive candidate has to do with a startling number. The United States spends 75% of its healthcare dollars treating chronic disease, and 70% of that spending could be avoided. That means that we could cut our healthcare budget in half by creating environments in which it's easier for American citizens to make consistent choices that lead in the direction of health. Could this really happen? We've seen it happen in dental care. When George Washington was elected to office, he had one natural tooth in his mouth. My dentist, who started practice in 1957, said that he spent about half of his time making and repairing dentures. He tells me that a child born today has a very good chance of never having a single cavity. I asked him what led to this transformation. He said, well, there were three things. The first is smart public policy. We fluoridated the water. Second, we created a very simple message, brush and floss. And third, we reinforced that message over and over. I believe it's possible to make this kind of transformation. Is that what will happen? Well, physicians are concerned about it. They fear that they'll wind up funding Obamacare with lower fees, higher costs of compliance, and higher taxes. They see this as a financial problem, and you are the financial expert. You offer something that physicians need. We know that they should be paying attention to retirement planning and wealth building. However, the fact that half of doctors feel behind where they'd like to be in retirement planning suggests that that knowledge alone is not enough to inspire action. However, a solution to the pressing problems today that Obamacare poses falls in the must-have region. What if you considered yourself a financial quarterback in charge of the general team whose job it is to build and protect wealth? How about if you brought in an expert to offer doctors ideas about how to generate more revenue? I strongly believe that the solution to physicians' problems is not going faster and stronger on their current hamster wheel. It's stepping off the hamster wheel and conducting their practice differently. In fact, I have a webinar that's pre-recorded that you're welcome to license and distribute to prospects and clients. I get pushback from financial advisors who say, wait a minute, that's not my job. I'm not a practice management expert. We don't expect Russell Wilson to kick the field goals either. He's the leader. You could solve other active problems, like helping physicians avoid lawsuits, or generate more referrals, or get better patient outcomes, manage their online reputation, avoid theft and fraud, or minimize tax burdens. At the beginning of this season, Russell Wilson went into the locker room and said, somebody's got to win the Super Bowl. Why not us? There will be winning physicians and winning financial advisors. You can be a part of that winning team. I know that physicians can achieve the personal and professional and financial goals that drew them to a career in medicine. Physicians need optimistic leadership, and I ask you, why not you? What if you were the person helping physicians really navigate Obamacare? Well, thanks for stopping by. I hope that you found value in this content. Please know that you are not alone. I've got lots of resources to help you step up into this leadership role with physicians. I've got the Cracking the Physician Code course in which you can learn how doctors think and build an infrastructure of a physician-friendly practice in a smart way. I've got a 2-day live Academy of Physician Engagement event. I've got done-for-you marketing like that webinar and the ebook, things that physicians want to receive. You also have access to this Inner Circle webinar in which I lay out the details of the Obamacare Primer. Thanks again for stopping by. Please feel welcome to reach out if there's any way in which we can help you acquire more physician clients.